Assalamualaikum and hi everyone. I am Kamilia Afrina and today I will be talking about sensory processing disorder or SPD. So let's see the details in the next slides. So, what is sensory processing disorder or SPD? So, sensory processing disorder is a condition that affects how your brain processes and sensory information or things are also known as stimuli. So, sensory information includes things you see, hear, smell, taste, or touch, are also known as your five senses. So, SPD usually means that you're overly sensitive to stimuli than other people who are not, or you are hypersensitive. So, children are most or more likely to have SPD than adults, but adults can have them too. So, the symptoms in adults have existed since childhood, most likely have existed ever since they are small. So, however, the adults have developed ways to deal with SPD that let them hide the disorder from others. There are four types of sensory processing. First is low registration, second is sensation seeking, third is sensory sensitive, and fourth is sensory avoiding. So, what is low registration? So, a child with low registration does not recognize or process all of the incoming sensory information, and they do not compensate by trying to gain more sensory input to meet their needs. They may seem uninterested or inattentive to their surroundings. Second is sensation seeking. So, a child classified as sensation seeking does not recognize or process all of the incoming sensory information. But, contrary to low registration, they actively try to gain this sensory input to meet their needs. They may be hyperactive, touch others often, and engage in unsafe activities like jumping from heights. Third is sensory sensitive. So, a child classified as sensory sensitive feels overwhelmed by sensory information, but they do not actively try to avoid the overstimulation. Instead, they may just display frustration. So, they may be easily distracted and irritable, cautious, and uncomfortable in loud or bright environments such as concerts. So, fourth is sensory avoiding. So, a child that is sensation avoiding feels overwhelmed by sensory information and will actively avoid the stimulation. They may run away from loud, busy environments, cover their ears when they overstimulated by noise, or wear gloves to avoid touching certain materials such as paint. Based on the book written by Lucy Jane Miller, the prevalence of SPD is at least 1 in 20 people in the general population may be affected by SPD. However, in children who are gifted and those with ADHD, autism, and Fragile X syndrome, the prevalence of SPD is much higher than in the general population. Some of the symptoms of SPD includes six types or six categories, that is tactile, visual, auditory, oral, olfactory, and vestibular. So tactile is sensitive to touch. So the people who are sensitive to tactile is sensitive to clothing textures and clothes labels. They also might dislike hair brushed or their hair washed. They react badly to being touched unexpectedly and have unusually sensitive to being too hot or cold. For visual, they might be sensitive or be overwhelmed in a visually busy environment. They might able to focus on little details in a picture but misses the whole picture. They also might lose his or her place frequently when copying from the blackboard. For auditory, they might be have low tolerance of noise generally, says that noise hurts their ears or give him or her a headache. Or they might not seem to register sound. They also might fail to respond to hearing their name called. For oral, for oral, they might be a fussy or picky eater with determined food preferences and limited range. For example, they might only want to eat mushy or hard food and not both at the same time. They might also lick, taste, or chew on inedible objects. They also might dislike toothpaste and brushing teeth. For olfactory, they might be disturbed by cooking, bathroom, or perfume smells, or they may not notice unpleasant, nauseous odors or be able to distinguish smells or fragrance. For vestibular, they might avoid playground apparatus and equipment. They might have fear of heights or may crave movement experience, especially fast or spinning. They might also be a thrill seeker and love activities such as bungee jumping or skydiving. Based on some research and studies done, there are no definite causes of SPD, but these are some of the possibilities that can cause SPD, such as premature birth, low birth weight, parental stress during pregnancy, alcohol or drug consumption during pregnancy, and also overexposure to certain chemicals and a lack of sensory stimulation in childhood. So, how to diagnose or know if your child has SPD or not? You may recognize your child's behavior is not typical or as normal as a normal kid would be, but most parents may not know why. Don't worry, you can just meet your doctor and discuss your child's behavior. Your doctor may refer you or your child to an occupational therapist, and these professionals can assess if your child has SPD or not. They will likely watch your child interact in certain activities or certain situations, and the therapist will ask your child questions, and all of these things will make them or will help them to make diagnosis. These are some of the treatments that can be done if your child has SPD. That includes occupational therapy, physical therapy, and sensory integration therapy. For occupational therapy, they might help a child to practice or learn to do activities they normally avoid because of their sensory issues. In school, therapists may also work with the child's teacher to be better support their sensory needs in the classroom. For physical therapy, a physical therapist can help develop a sensory diet. This is a regimen of activities that are designed to satisfy the craving for sensory input. This can also include doing jumping jacks or running in place. Additional supports like weighted or sensory vests or scheduled sensory breaks may also help. Sensory integration therapy is both the addition or combination of occupational and physical therapy. So this approach may help the children to learn ways to appropriately respond to their senses. It is designed to help them understand how their experiences differ so they can figure out a more typical response. So, what can you do, or what parents can do to help your child overcome SPD? Is first, you can give the support that they need, includes talking with a doctor or pediatrician about the child's sensory processing. Second is talking with the child's teacher and school support staff about the child's sensory processing. Third is seeking out support, including occupational therapy and physical therapy. Fourth is frequently checking in with their child about what they are feeling or what your child is feeling, so they would be able to let out or vent out whatever they are feeling. Fourth is teaching your child on how to let adults know if they need a break or feeling overstimulated. And last but not least is supporting your child's occupational or physical therapy goals by giving out practice or help doing it at home. That is all from me. Thank you for watching. Bye bye.